Welcome, doctors. In today's video, we'll be talking about an essential yet often frustrating part of the weight loss treatment process: prior authorization for Zepbound, also known as tirzepatide. Zepbound is a powerful medication used to manage chronic weight issues, particularly for patients with obesity or obesity-related conditions like sleep apnea, diabetes, and hypertension. But to get access to this medication, you know how critical the prior authorization process is. Insurance companies require detailed documentation before they'll approve Zepbound, and this is where things can sometimes get tricky. Now, let's take a closer look at the process. Imagine you've just had a new patient consultation, and you've determined that Zepbound is a suitable treatment. The first thing you'll want to do is verify the patient's insurance coverage and check whether Zepbound is covered on their formulary. With tools like Eligibility Essentials or Cover My Meds, this can be done quickly. But if Zepbound isn't covered, you might need to prepare for a formulary exception. Once you've confirmed the coverage, the next step is identifying the correct prior authorization form. This varies by insurer. Aetna, UHC, Cigna, and others all have their own processes. If you're not sure which one to use, don't worry, Staffingly's virtual medical assistants, VMAs, are here to guide you through. So now, let's say we've gathered all the necessary documents, things like diagnosis codes, BMI, comorbidities, and lab results. The more thorough we are here, the better the chances of getting approval on the first attempt. This is where having a detailed checklist and experienced support really comes in handy. Next, your VMA will complete the PA request form with all of this documentation. It's critical to make sure every field is filled out correctly, because even one missing document could delay the process. Once the form is submitted, we monitor it closely to track the status. If we don't hear back in a few days, follow-up is key. If your PA request gets approved, great. We notify you, the pharmacy, and the patient. But if it's denied, don't worry. We'll review the denial reason, correct any missing info, and resubmit. Sometimes, a peer-to-peer review may be necessary to escalate the situation and ensure the patient gets the care they need. Staffingly's VMAs ensure that everything is updated in your EMR system, so you have a complete audit trail for billing and future reference. We even flag reminders for reauthorization when needed, helping you stay on top of it all without added stress. The goal here is simple: streamline the PA process to give your patients faster access to the treatment they deserve. Headaches. If you're feeling overwhelmed by the complexities of Zepbound's prior authorization, Staffingly's is more efficient. Before we wrap up, remember, prior authorization doesn't have to be a pain. You can reduce denials and get your patients the medication they need with minimal delays. If you have any questions or thoughts, feel free to drop them in the comments. Don't forget to like this video, and if you want more helpful tips like this, hit the subscribe button and ring the bell for notifications. Thanks for watching, and take care of your patients.